If your legs feel heavy, achy, or swollen by the end of the day, and you keep telling yourself it's nothing, this video is for you. Varicose veins are common, but in some cases they can be more than just a cosmetic problem. The good news is that there are effective options that can help reduce symptoms, improve appearance, or treat the affected veins, depending on the case. Today, we'll look at 3 common options doctors use to manage or treat varicose veins: compression therapy, sclerotherapy, and endovenous laser ablation. But first, why do varicose veins appear? Your veins carry blood from your legs back up to your heart. Since that blood has to move against gravity, your body relies on leg muscle movement and tiny one-way valves inside the veins. These valves help keep blood moving upward and prevent it from flowing backward. When those valves become weak or damaged, blood can pool inside the vein. Over time, that pressure can stretch the vein wall, making the vein swell, twist, and become visible under the skin. Risk factors include long hours standing or sitting, excess weight, pregnancy, hormonal changes, family history, and aging. For some people, varicose veins cause aching, swelling, heaviness, itching, or skin changes. So what can be done? Option number 1, compression therapy. Compression therapy uses controlled pressure around the leg to support blood flow and reduce symptoms like swelling, heaviness, and discomfort. One example of a product in this category is the Vein Target Band system, but the important point is the concept. Properly fitted compression can help some people manage symptoms day to day. Still, compression is not a magic cure. Major guidelines make it clear that compression should not be treated as a permanent solution when a patient is a good candidate for medical procedures. It can be useful while waiting for evaluation, when procedures are not suitable, or as part of a broader treatment plan. So, compression may help you feel better, but if your veins are getting worse, painful, or causing skin changes, you still need a medical assessment. Option number 2. Sclerotherapy is a common medical procedure used for spider veins and some smaller varicose veins. A doctor injects a special solution into the affected vein. That solution irritates the inside of the vein, causing it to close. Over time, the body gradually absorbs the treated vein and blood is redirected through healthier veins nearby. This is usually done as an outpatient procedure, meaning you can often go home the same day. Some people need more than one session, depending on the size, number, and type of veins being treated. Sclerotherapy is well established, but it still needs proper evaluation. It is not for every vein, and it is not for every patient. Possible side effects can include bruising, swelling, skin discoloration, or irritation near the injection area. Rarely more serious complications can happen, which is why it should be done by a trained medical professional. Option number 3, endovenous laser ablation, or EVLA. EVLA is usually used for larger varicose veins caused by reflux in major superficial veins, such as the great saphenous vein. In this procedure, a thin laser fiber is placed inside the affected vein through a very small entry point. The laser heats the vein from the inside, causing it to close. After that, blood naturally reroutes through healthier veins. EVLA is minimally invasive, usually done under local anesthesia, and many patients return to normal activities fairly quickly. It has largely replaced older surgical stripping in many cases because it can offer strong results with less pain, fewer complications, and faster recovery for suitable patients. But again, the right treatment depends on the vein, the symptoms, the ultrasound findings, and the patient's medical history. That decision should be made with a qualified clinician. Before you go, here's the important part. These 3 options, compression therapy, sclerotherapy, and endovenous laser ablation, cover a range of care, from symptom support to medical treatment. But this video is for educational purposes only. It is not a diagnosis, and it is not medical advice. If you have aching legs, swelling, heaviness, itching, skin changes, or veins that are getting worse, talk to a doctor, vascular specialist, or vein specialist. You need to know what is actually causing your symptoms before choosing a treatment. And if you notice one-sided leg swelling, increasing pain, warmth, redness, bleeding, skin discoloration, an open sore, or sudden changes in one leg, get medical attention. Those signs may need prompt evaluation. Take care of your legs. They carry you through everything.